Blood thinning medication and herbal supplements should be avoided at least 2 weeks prior to procedure and 2 weeks after the procedure. Some common blood thinners include Advil, Aleve, aspirin, ibuprofen, Excedrin, Motrin. Some herbal supplements include fish oil and vitamin E. These should all be avoided at least 2 weeks before and 2 weeks after. A link to the list of blood thinners and herbal supplements to avoid is available in the description below. Alcohol should be avoided a week before the procedure and a week after the procedure. Avoid caffeine 2 days before the procedure and 2 days after the procedure. It is very important to have a caretaker in mind during your pre-op call. A caretaker is required for a patient that is going under anesthesia. A caretaker is responsible for picking up the patient and staying with them for the first 24 hours. The caretaker's name and phone number must be provided during the pre-op call. Please let us know if you do not have a caretaker so we can help provide one. It is very important to arrive on time at the schedule and check-in time. Please allow flexibility during your day because surgeries can run a little bit longer than scheduled and end a little bit sooner than scheduled. Prescriptions will be sent to your preferred pharmacy prior to surgery. Bring your medication with you the day of your surgery. We will go over them in detail in person the day of the surgery with the nurse present. Most medications are covered by insurance. If not, there are options such as GoodRx. Some materials you'll need to purchase before the procedure include hydrogen peroxide, bacitracin ointment, Q-tips, gauze, ice or frozen peas, powdered greens and whey protein powder, baby shampoo, straws, and prepare soft foods. A small supply bag will be provided to you after your procedure. This will include 4x4 gauze, bacitracin ointment, medical Q-tips, Pearson spray, and a neck pillow to help stabilize your head and provide extra comfort when healing. Patients going under anesthesia must refrain from eating and drinking 8 hours prior to your procedure. This includes water. Your medical history will be verified by one of our nurses to verify if you need medical clearance before your procedure. A non-refundable deposit of $1,000 is required to secure a surgery date. There is a $500 rescheduling fee to change your surgery date if you cancel within 2 weeks of surgery. There is a $2,000 cancellation fee 48 hours or earlier prior to surgery. Cancellations within 24 hours of surgery, a $3,000 fee will apply. All fees for surgery are due within 2 weeks prior and are non-refundable. Any cancellation fees cannot be applied to other services in the office. Day of surgery, please arrive with no makeup, no fingernail polish, and no piercings around your face or neck. If you have facial hair, please shave and come with a clean face. Please wear comfortable clothing and shoes that you can easily take on and off. You will go home in our robe that we provide you. We will need a urine sample the day of surgery per anesthesia for a pregnancy test. Please be mindful not to pee right before you arrive. We will be prescribing a list of medications based on allergies that varies from patient to patient. Please remember to bring in all medications that were called into your pharmacy the day of procedure, as you will be taking them with a nurse present. You will be prescribed an antibiotic to help prevent infection. You will either be prescribed Keflex or clindamycin. The instructions for Keflex are 1 tab every 12 hours, twice a day. The instructions for clindamycin are 1 tab every 6 hours, 4 times a day. You will start taking your antibiotic the night of surgery. It is very important to finish your antibiotic as it helps prevent infection. You will be prescribed 5 medications to help with pain and discomfort. These include Celebrex, gabapentin, Valium, Norco, and Tramadol. You also can take Tylenol Extra Strength 1,000 milligrams. This is over the counter. This is every 6 to 8 hours. Celebrex and gabapentin are 1 tab every 12 hours. Valium is 1 tab every 8 hours as needed. Norco is 1 tab every 4 to 6 hours, and Tramadol is 1 tab every 4 to 6 hours. If you are taking Norco or Tramadol, wait 1 to 2 hours apart before taking Valium. You will also be prescribed a steroid to help with swelling. Start the morning after surgery. Please follow the manufacturer's instructions on the package. One possible side effect of anesthesia is nausea and vomiting. To help reduce the chances of experiencing this, a patch will be placed on you the morning of surgery. The patch is called scopolamine patch. It can be worn up to 3 days post-op. Please wash your hands immediately after removing. It is normal to experience minor bleeding from incisions for the first few days after surgery. The medication that will help minimize this amount of bleeding is called TXA or tranexamic acid. Please take the remaining pill the night of surgery. Do not take if you are on birth control or any hormonal replacement medication. A nurse will instruct you if necessary to take clonidine. This is 1 tab every 8 hours as needed to help lower your blood pressure. When you wake up from surgery, you will have a tight wrap around your head. This wrap can be removed 48 hours at your post-op appointment unless instructed otherwise. Ice and clean any exposed areas, but do not worry about the incisions or areas covered by the wrap. At your post-op appointment, you'll be provided a reusable compression garment. Please wear as much as possible for the first week. This garment should be removed when chewing food, showering, and brushing teeth. After week 1, the garment is only worn at bedtime. Please wash the garment by hand as needed. For the first week after your procedure, it is important to clean your incisions 2 to 4 times per day. You're going to spray the area clean with Pearson spray and dab it dry with gauze. Using a 1-to-1 ratio of hydrogen peroxide and warm water, please take a Q-tip and clean directly over the incisions. Once the area is dry, use another Q-tip to apply a thin layer of bacitracin ointment to the incisions. If you are unsure of where your incisions are, please ask a nurse. If your procedure included a lower bleph and your incisions are along the lower lash line, please spray Q-tip with Pearson and gently roll over the incisions. Dry the area using a clean Q-tip and apply Refresh Tears PM or any artificial tears gel. If your procedure included a lower bleph and the incisions are inside the eye, there is no external incisions to clean. If your procedure included an upper bleph, please spray Q-tip with Pearson and gently roll over the incision. Dry the area using a clean Q-tip and apply Refresh Tears PM or any artificial tears gel. It is very important to ice after your procedure, as swelling is the most prominent during the first week. Please apply ice under the chin, on the forehead, and to the cheek eye area for the first 3 days. Ice 20 minutes on and 20 minutes off. The recommended diet after your procedure is soft food for the first week. This includes protein shakes and smoothies. We also recommend powdered greens daily. Please avoid foods with high salt content, as that can cause swelling. No carbonated beverages for 2 weeks. Please refrain from showering until your 2 days post-op. Use only cool or lukewarm water. Avoid hot water during the first week. Please use baby shampoo to wash the hair for the first 2 weeks post-op. Please do not use conditioner on the scalp.